Was Annie going to do a little introduction, or should I just start talking?
Well,
no, we're live now on the internet. So we're on YouTube live now. So Annie, take it away.
Okay. Well, first of all, welcome everybody. We are really pleased to be able to offer you this program tonight. It's extremely informative and it's very timely. Our presenter is Dr. Dana Rose Garfin. She's an assistant professor in the Sue and Bill Gross School of Nursing at UCI. Her research focuses on the way that negative life events and community disasters affect physical and mental health during the course of a lifespan. She also studies how interventions such as yoga and nutrition and mindfulness can help alleviate the stress and trauma. On the personal side, Dana's a vegetarian, she's an environmentalist, she's also an avid surfer, a yoga guy, a mediator, and she teaches classes in mindfulness and Pilates, and that's all in addition to her coursework at UCI. Dr. Garfin's democratic activism goes way back. In elementary school, she worked on the Clinton-Gore campaign. And much more recently, she's been a volunteer for Harley Ruda. So she has a lot of experience there. And then lastly, we found out through the course of our emails back and forth that we each have a rescue dog named Madeline, and that we each love our dogs so much. So thank you so much. Please put your questions in the chat room. Dr. Garfin will answer them probably after she's talked for a little while. And then after the presentation, anyone who wants to stick around can to have chat, please do. So thank you so much. Thank you, Dr. Garfin. Thank you for coming to talk to us. We just really appreciate it. So thank you.
Great. So can everyone hear me okay? Okay, well, thank you so much for having me. I'm really excited to be here with you guys tonight and share a little bit more about my research on the pandemic and COVID-19. And again, yes, I'm a longtime Democratic Party activist. And I will also say that I was a Democratic activist in Indiana, in rural Indiana, where my parents did not have the heart to tell me that we were probably not going to win the state. But I went and knocked on doors anyways, and they were very supportive and encouraging. And so, yeah, it went way back. So a little just more bit about me and my background and how I started in this line of research. Like Annie was saying, I'm a longtime activist. In college, I studied social and environmental justice issues. I was in a program called the International and National Voluntary Service Program. It was a 2-year service learning and leadership program. We were able to do service learning projects on the Dene Nation in Arizona. We went to rural Mexico. We worked with some really great Catholic service worker organizations that were actually helping people cross the border. I think illegally, but they basically, the way they framed it is like, we're going to help people with their plans. And so they did that. So we were able to do a lot of really cool and interesting things. And so that just really ignited my passion for a lot of these issues. After college, I was living in India. I was studying meditation and yoga in India. And I was also volunteering, teaching conversational English to a lot of refugees who were living from Tibet, who were living in northern India. And kind of through this experience, I became much more interested, or like, I guess, additionally interested in the kind of psychological ramifications of this, right? So like all this stuff is kind of like experience, or is all kind of existing under this kind of large scale umbrella of this social and political disruption. But when I was overseas, I realized this is actually impacting people's physical health, their mental health. And basically became really, passionate about the fact that if we can't help people at this kind of like individual level of analysis, how are they going to be the kind of people that can rise up and truly make social change? So that's kind of the background. So after I got back from India, I wanted to be a psychologist. I had not taken any classes in psychology. So to go get a PhD in psychology, I needed to get a little more research. So I worked in a mood and anxiety disorders lab at Stanford University. And through that connection, I was introduced to my dissertation chair down here at UC Irvine. So that's when I moved down to Orange County many moons ago. And so when I came to Orange County, I was interested in studying individuals' responses to large-scale events. That's kind of how this all started. So in the field, we refer to these events as collective trauma. So by collective trauma, these are large-scale events that impact the populace broadly through both direct and media-based exposure. And as a caveat, I really didn't set out to study the impact of media exposure on people's physical and mental health. So I kind of really was interested in sort of this direct exposure to trauma, right? Like you experience a war, you're a child soldier, how does that impact your health? But over the course of doing all these studies, a really robust and consistent finding across all these different events that I've been working on and I've been studying is the impact of media exposure. So really, if you're going to think about the way these large scale events impact people's physical and mental health, you just have to be also considering the way that the media is influencing that, or I think it's really hard to get a full picture of the event. So throughout the course of my career, I've studied the impact of events, including terrorist attacks. So I've looked at people's long-term responses to 9/11. And in some of those studies, and again, probably everyone on the call is old enough to, some of my students now don't remember 9/11, some of my college students, but of course, probably, I don't know if there's any young college students on the call, but anyone who's in their mid 20s or older probably, remembers when 9/11 happened. And so, we all know kind of what a watershed moment that was for people. And, and I'll talk a little bit more about, really had long-term implications for people's physical and mental health all over the country. I also did a longitudinal project on the Boston Marathon bombings. And that was kind of, after 9/11, we hadn't had a domestic act of terrorism in, over 10 years. So when the Boston Marathon bombing happened, that created a lot of kind of social uncertainty. Was this the next 9/11? Was this an isolated incident? So, I think that activated and primed people for a lot of those kind of fear responses as well. I've also studied natural disasters. So I've studied the 8.8 magnitude Chilean earthquake, which was one of the largest earthquakes that was ever recorded. And again, we'll talk a little bit more about this, but we did see even for an earthquake, this effect of media exposure, right? So, and in fact, we found that survey was a nationally representative sample of Chileans. So we surveyed 2,000 people after this big earthquake. And we found that in Santiago, which felt the earthquake 500 times less strongly than the people at the epicenter. The people at the epicenter of this earthquake felt the earthquake 500 times stronger. Their rates of post-traumatic stress disorder were similar. They were almost identical. And when we looked at why that was, we saw that for people that were, people in Santiago, it was a very big earthquake. They still felt it, right? It wasn't like they didn't feel it. But what was associated with their particular distress response was how much media they were exposure that they reported watching. So, again, we kind of, see this pattern. I've looked at tsunamis, hurricanes on the Gulf Coast, violent events such as school shootings or the Orlando nightclub shooting, as well as public health crises like the Ebola public health crisis in 2014. And now research on COVID-19. So that's kind of just like a little bit about my background, some of the issues I've been working on. And we kind of look at it from these kind of different levels of exposure, both like, were you actually there? Were you physically there in a close geographic proximity? What happened to you? And then were you exposed to it via the media? And then if you were exposed to it via the media, are there different components or amounts or type of media exposure that are particularly impactful for people? So I want to talk a little bit about why we want to study the acute stress response, and then a little bit about what makes COVID-19 so unique in terms of studying a stress or a trauma. So first I want to stress that, so the acute stress response is basically your immediate response to an event, right? So a lot of us have heard about post-traumatic stress disorder. So these are kind of these re-experiencing symptoms. You might have dreams. Do you feel like something's happening again? It was first evident in veterans, but now we kind of see it after a range of different kinds of traumatic events. So that happens after 30 days, right? So you can't be diagnosed with post-traumatic stress disorder until at least 30 days after the event. So what you have in the interim between the event happening and that kind of opportunity for a diagnosis of PTSD is what's called the acute stress response. And the symptoms are very similar. So it's basically like early PTSD. So why is that important to consider? Well, it can be a precursor to PTSD, although not always, because people are adaptable. People are resilient. So even when bad things happen, a lot of times people can recover, which is amazing and, which is absolutely fantastic. But we want to understand why so many people don't necessarily bounce back, right? So acute stress and that kind of early response tends to predict later responses that aren't so good. What's also important to consider is that initial response can activate the stress response symptom, right? So kind of from a biological perspective, when you experience an event, you'll have an activation of the sympathetic nervous system response. So, and that's basically like the fight or flight response, right? So an event happens, your heart rate increases, you will have a stream of hormones that will be released, cortisol, norepinephrine, epinephrine, eyes get bigger. So all these kind of physical activation that readies the body for flight, right? So, and in modern society, it's not usually an imminent threat, right? It could be something we see on TV, or it could be something, we hear in the news, or stress from our job, or a real stressor, right? Like a earthquake or a tsunami or a terrorist attack where your life actually is threatened. So why that's important to consider. That initial reaction, which is psychological and we can measure with psychological tools, but also has these correlations in your physiological stress response symptoms, those predict physical and mental health later, right? So if you have a stronger acute stress response, you are more likely later on to have pain, disability, all-cause mortality, depression, anxiety, and cumulative psychiatric disorders. And I did a lit review of previous studies that have looked at some of these effects. And my colleagues and I found that in general, these effects were pretty strong and they persisted both in the short term. So that's, between about a year after an event happens, as well as in the long term. So even more than a year. So what that all kind of sets this up to say is that trauma and your reaction to it is generally bad for your health, right? And there's both a psychological impact of that as well as this kind of like physiological response that latches onto that. So we also know that from the stress and coping literature that chronic stress is bad for your health, right? So we can kind of think about these things, and this is, why the COVID pandemic is super, I think, stressful for people, is because you have this kind of acute stress. So an acute stress is like a terrorist attack, right? It happens, it's terrible, but there's an end to it, right? Like the bomb itself is only happening for like a matter of seconds or minutes, right? 9/11, I mean, it basically happened in a day, right? And then it was all that recovery. A hurricane, it could happen over a few days. An earthquake happens over, a few minutes or hours, or the aftershocks. But, it's pretty much like a truncated event, right? And that allows people to start the recovery process. So we know from stress and coping literature that stressors that go on, and a lot of times, like, probably a lot of people on this call, maybe taking care of parents that are getting elderly. Anyone have parents or a loved one? Yeah, so I don't have to tell people to raise their hand. That's very stressful. And actually, researchers that want to study chronic stress will often use a population of caregivers because they're so chronically stressed. It's something you're dealing with day in and day out without a break. And that is also bad for people's health. So in samples of caregivers, caregivers are more likely to get a cold if they're exposed to it. If they get an injury, they've done studies where they'll give people a little cut, like a small one, but they'll take longer for their skin to heal. So they do tend to have these kind of, more susceptibility to illness, and then, anxiety, depression as well. So again, with the COVID pandemic, we're kind of experiencing like the acute stressors, and we're kind of experiencing the chronic stressors, right? Like even with the pandemic, I mean, I remember when the stay-at-home order was first implemented here in California, and then I turned on the news and I saw the stock market tank, and I just remember feeling like the world was ending, and even though I study media and I know how bad media is for your health, I mean, I could not tear myself away from the TV. I was standing right there in front of that TV hours. And then I was on my phone in case the TV wasn't telling me something, that I needed to be updated. Right. So it's like, you're kind of experiencing it while it's happening. And then, at this point, this is 4 months and we're still dealing with the pandemic. So we have this acute stress and this level of chronicity. So in terms of the chronicity factor, people that I've been talking to have asked about COVID-19. I've compared the situation to Hurricane Katrina a little bit on a smaller scale, because Katrina really displaced a lot of people in New Orleans. They had to move out of their house. Their community was destroyed, and it was really hard to get back to normal, right? Like the recovery process was very long, and people were saying really they never really totally recovered for some communities. So we're kind of experiencing that, but like everybody in the world, or like a lot of people in the world. And, certainly, America is not faring very well at this point. So, I kind of want to emphasize that part of the, that there's these little events, like maybe you lose your job, and someone gets sick. You might have tragically known someone who's in the hospital or dying. So you kind of have these little like acute stressors, and then they're ongoing as well. People also don't deal well with ambiguity. Right. So it's really hard not knowing when is this going to end. Right. Like I think, all of us were like, even if they said, okay, you're stay at home till the end of 2020, and then 2021, January 1st is back in the streets, we'd probably all be able to deal with that. But it's really hard to just not know when this is ending. And that's really hard for people as well. Another thing that I want to point out that's very stressful about COVID-19 is in the stress and coping literature, we also talk about key secondary stressors. And so this is kind of events that are caused by the event, but they're not directly related to the event. So for Katrina, you have the hurricane, but then you have people lost their pets, they lost their loved ones, they lost their house, they lost their job. So it's all these things that happen kind of in the disaster cascade and the aftermath that, are problematic for people as well. And there is a little bit, very teeny bit of evidence in the literature that if nothing bad ever happens to you, you are less resilient. That is true. But overall, more bad stuff leads to more bad outcomes, right? So it's people that have had like nothing happened in their entire life are not very resilient. But, in general, it's not like more tragedy makes you more resilient. More tragedy is just more tragic. And so that's pretty consistent. So, and we find that with secondary stressors as well. So the more bad things that happen to you after an event like this, the more problematic it tends to be. So with COVID-19, we just have it coming from so many angles. Like so many people have lost their job, or their loved one lost their job, or they lost money, or they have decreased wages. They're sick, their loved one's sick. So we have all this kind of like the perfect storm confluence of a stressor, right? This is COVID-19 that we're all living with, right? And, something else, and Annie and I were talking a little bit about this when we kind of, talked about some of the points, but even with that, it is not evenly distributed in our population. So one of my graduate students and I, we just wrote a paper that came out. There's been, for example, like an uptick in domestic violence, which is also associated with stressors in the home. So for some people, they're staying home with their abuser. Maybe their abuser lost their job. They're even more stressed out. They're lashing out even more. And then, someone that might be able to leave, now they have a fear of leaving. They might not, want to go to a shelter because of the coronavirus. So, it's kind of causing these ripple effects throughout society. And another issue with COVID is that a lot of the things we normally suggest for a community or an individual in the aftermath of an event are antithetical to the COVID recommendations. So in a community, and I will say this because we've been talking a lot about this in the news, getting the kids back to school is very important. Normally, we say after a disaster, you want to open the schools. If school's in a parking lot, if school's at a church, like getting the kids back to some kind of normalcy is just so important for the children and for the family and community, right? So when this first started, it was like crazy because the one thing that your kind of foremost thing to get back in the community is closed, right? And now, I mean, we might not be able to open in the fall, right? And I know that there's a lot in the news that is really encouraging people to kind of stay home and not have these barbecues and events so that we can open schools in the fall, because, ultimately that's probably going to be a choice that we're making or probably already have made, probably not to the benefit of children in our communities, unfortunately. So, that's just one example. And then also, it's really hard for people to get social support, to stay engaged with their community. These are things we normally would recommend, like see a friend, go on a walk, go to church, these kind of, things that tend to help people during times of crisis were actually taken away from us. And we're actually not recommended to be doing those things. So, I think that that's just something to kind of set the stage that, and I will talk a little bit about like what at the end, like what can we do to help? Because, we kind of now are going over like all of these negative factors, but, I do think, and I'll talk a little bit about this in the conclusion, that COVID has created a lot of opportunity for us as society and has given us, at least people in positions of some level of privilege, an opportunity to like shift and make some resources maybe more equitably distributed. So that's kind of setting the stage for COVID. So the second thing I want to talk about is the impact of media exposure on both physical and mental health. Because like I said, even though I know media exposure is not good for my health, during COVID, I've gotten better. But the first couple of days, and I'm doing a study on media exposure of COVID, I can't turn off the TV. So I really understand what that urge is like to want to stay informed. But I do think it's important that we try to limit it to some degree. So again, I didn't mean to be a media psychologist. It wasn't something I, really was thinking about too much until I started running these studies. So in the study of the Boston Marathon bombings that I conducted in 2013, we published a paper using 4,600 Americans across the country. And we found that, this is probably not surprising, that media exposure to the bombing was associated with acute stress. Okay, I can answer this question right in this. Yeah. Yeah, very good question. Okay, so I'll say a couple of things about that. First, what was interesting about the media exposure study that we could not believe when we found it, and we ran the analyses 8,000 different ways. High levels of media exposure were more distressing than even being at the event. Not for everybody, right? But this is 4,600 people. So we're looking at averages across there's always individual variability, but kind of as a whole, these high levels of media exposure were as distressing or even more distressing than actually being there, right? So it just really kind of shows that, when you are having those experiences, they can be very profound. Now, in terms of the type of media exposure that is distressing, we have done studies that have shown graphic media coverage, right? So this probably isn't as relevant to COVID, but anything that has to do with like death, blood, those type of things, that tends to be particularly problematic. So I definitely, would recommend that when they kind of say the viewer discretion advised, maybe that's a hard one, right? Because when we think about why George Floyd, which is kind of also related to all this, why was that so impactful for people? People saw a human being killed in broad daylight and they saw it on social media. You know, so to the effect, despite the fact that I do think that people should limit their exposure to graphic media coverage, something about seeing that, I mean, was so horrible for people that it motivated people to action. You know, so I think, you know, a lot of this stuff, it's not black or white. It's not like turn off the TV and don't ever watch anything. Yeah, so the media is showing the ICUs and the intubations. You know, I think that those types of images tend to be more distressing. And we have shown that seeing those types of images, particularly with death, dying, dead bodies, blood, those are associated with worse mental health and actually physical health as well. And so after 9/11, even people who were not at 9/11, not living in New York, if they had responded very negatively to 9/11, they actually were more at risk for new incident cardiovascular disease 3 years later. So being exposed to this stuff, whether you're there or not, and if you have those kind of strong reactions to it, I mean, it's measurable, you know, new onset cardiovascular problems. I mean, it's really like, you know, it's what we're putting in our body. It's what we're putting in our soul, you know? So I think, you know, just to kind of be cognizant of that, you know, without, again, throwing the baby out with the bathwater, that there's no ever need for that or no ever, you know, situation where it can be helpful for society, but just, you know, when we're kind of thinking about overall physical and mental health. So it is those media coverages of the kind of graphic and death that tends to be more distressing. I think that there's a big difference, and I talked to a lot of reporters about this during COVID. There's a big difference between reading the news in the morning and watching CNN all day, right? And again, even with our initial study of the Boston Marathon bombings, it wasn't necessarily people that watched the news for a half an hour or an hour that we found, you know, had these like intensely profound effects on physical and mental health, but it was really that like constant checking, that constant watching over and over and over again, you know, without probably a lot of new information. And that kind of sets up the brain, right, for this kind of ingrained circuitry, right? So you're kind of remembering it. It's kind of creating that condition of post-traumatic stress disorder, of the re-experiencing, and it's solidifying that circuitry in the brain. Right. So there's been some neurological studies that can kind of show that even media exposure to something can be associated with symptoms that are like flashbacks neurologically. So we're kind of wiring our brain that way, unfortunately. So yeah, we saw this after the Ebola public health crisis. We saw that people that watched a lot of media coverage, even in America, like we had very few deaths after Ebola, but that was associated with more distress. And then with COVID, I mean, this probably will not come, this is definitely not our most shocking finding from the study, but we just recently conducted a study of over 6,500 Americans, and they were assessed in mid-March to mid-April. So kind of during the early phase of the pandemic and during the initial stay at home. We assessed them in 3 cohorts, and the stress levels increased over the 3 cohorts. Again, perhaps not surprisingly. We found that people with pre-existing mental health, physical health, they were at greater risk for pandemic-related acute stress. So again, kind of like these predispositions. You don't necessarily always see physical health though. So I think that also kind of speaks to the fact that like this stress is not evenly distributed in the population during this pandemic, right? Because like people with pre-existing conditions knew they were more at risk, right? And they were more distressed by that. So it's kind of setting up this inequality right there too. We found that daily hours of COVID-19 related media exposure was associated with increased distress. We also found that conflicting news. So the more you reported seeing conflicting media coverage, that was distressing, right? So this mixed messaging is not only bad for public health because people don't know what they're supposed to be doing and is stressing them out, right? It's causing measurable negative effects on their mental health. Also, we found, however, even if you were unsure if you believed in the pandemic, if you watched enough conflicting news, you were still more likely to take health protective behaviors. So if we're getting anything out there, people are hedging their bets, right? So as long as they're hearing enough information about we need to wear masks and we need to social distance, as long as they're hearing that enough, they will take their precautions in general. So that's a little encouraging. So I think that messaging is really important to get out there, even though, of course, we don't want to stress people out. And then again, perhaps not surprisingly, exposure to secondary stressors. So people who lost their jobs, school, work closures, they were all associated with higher acute stress as well. So another factor that I think is really important, and I know probably a lot of people on this call are probably pretty passionate about this, is the socioeconomic inequality, right? And it's just, people are experiencing this pandemic so differently. Even during the shelter in place, sheltering in place in an apartment with one bedroom, with your husband, with your kids, is so different than sheltering in place with a view of the ocean. It just is different. It's not the same. People, a lot of them are unable to work from home, right? So some people have to go to work. I'm very privileged. My job at UCI, I was able to teach my classes online and do my work from the house. But, there are a lot of people that are not able to do that. And so they had to go out in the world every day. And again, we've all seen these kind of videos of people at Walmart now having to enforce masking orders. And it's like, they're putting themselves more at risk. We did a study of essential workers during COVID-19, and we looked at healthcare workers as well as restaurant workers and grocery store workers and these other people who are now considered essential workers as well. And what was really interesting was some of the most distressing factors were people that couldn't obtain health insurance. If they lost their wages, that's probably not surprising. If they had prior mental health ailments, physical health diagnoses, Hispanic ethnicity, but also people who were not healthcare workers had more functional impairment. So they were doing worse. And we don't know for sure because we didn't ask this question yet. Might do it in our follow-up study. They don't have training. So these are like the people at Walmart or the grocery store. They don't have protective equipment. They maybe have some little mask. They're fighting with the customers to put on a mask and step back and stuff. So they're actually a lot more stressed out about it than, maybe even a healthcare worker who is highly trained. They feel competent. They have more resources. And again, this wasn't looking at, a hospital in New York where the pandemic was out of control. This was like a sample of 6,500 Americans that we drew this from. So, most of the healthcare workers, were probably not in a dire strait situation at the time of the survey, because this was also in early March. So the pandemic, it might be very different now, but at the time, that was what was reported. And we didn't want to make the point, that healthcare workers weren't stressed out, because they were. It's just that there was kind of an additional burden on these people who didn't have the training and probably didn't have the resources, right? So it's not to minimize the stress of a healthcare worker, but just to point out the kind of added burden of some of these people in these lower positions that have to go out and earn a living and do so at the risk of their health without the necessary precautions. Yeah, and just to kind of stress that, when we're thinking about healthcare workers, of course, that's really important, but we need to think about the health and well-being of these non-healthcare essential workers as well. So I think that they're, again, probably on this call, especially everybody is aware of the hyper politicized environment that we're in and how problematic that is at the moment. But again, I think, the George Floyd protests, it did create this additional level of social upheaval for people that I think was distressing. But at the same time, I think people that were under so much stress already and so aware of what was going on in the world, even in this community, to see so many people take to the streets, pandemic or no pandemic, I think was really inspiring, to a lot of people. Every day they were getting bigger. People who I were posting on Facebook and Instagram, I never thought would go to a protest in their lives, were out there with their mask and a sign. And, I think this kind of like led society to a breaking point. But I think maybe in some ways it was a breaking point to happen, and allowed us to kind of all have these conversations and have a reckoning of sorts, which I think a painful one, but hopefully one that ultimately will have positive outcomes for society. Again, my student did an analysis. So I mentioned that I had done a study of the Ebola public health crisis back in 2014, and as well as the coronavirus. And we found that in 2 representative samples, so these were like completely different people, although conservatives and Republicans were more threatened by the 2014 Ebola epidemic, liberals and Democrats were more threatened during the 2020 coronavirus pandemic. So I just think that really, yeah. So normally, and we found, we asked their threat of to the flu, the seasonal flu, and we asked that both times, there was no difference. So Democrats and Republicans, liberals and conservative, they don't view their pathogen threat in general differently, but depending on who's in office, they will view the threat of a novel disease from overseas completely differently. It's completely the opposite direction. The graph is like this and like that. It's crazy. So I think that really kind of speaks to the point of how much these people in power, really have to sway public opinion, and how much that people are really looking to their leaders during times of crisis to know what to do. So that finding was really interesting. That's hot off the press. We'll be submitting. It's not published yet. We'll be submitting it this week. But I think it's hopefully can kind of show and highlight the way that people are processing this information so differently depending on their identity and their political identity. But again, I think, as I mentioned earlier, it's really important to just get that information out there, because even if people are having conflicting information, they will hedge their bets. So that was kind of encouraging. So the next thing I want to talk about is kind of going on with what can we do about all this. And one thing that I had been thinking a lot about was the use of technology, because we're even here on Zoom using technology so much more. And, again, when I think of the media, we know that can be problematic. There's been a lot of, they call it doom scrolling. Has anyone heard about doom scrolling yet? It's like you're addicted to scrolling through your social media feed about the bad news. Apparently that people are addicted to it. So, I mean, it's really interesting. There's been a lot of people from addiction and media studies. They look through, they've talked about how this information doesn't have a stop point anymore, right? So old school, you'd finish a show, turn it off, go do something else. Or you get to the end of a newspaper's over, you go do something else. There's no stop point. You can click, YouTube, Facebook, Instagram. I mean, the time goes by and you're knee deep. You don't even know what you're reading anymore, right? So it's it can definitely have that element. So, I've been encouraging people to be mindful, because I also feel technology can be a really good thing, right? So it's important. And I know when kind of thinking of social justice issues, that some people can't work from home. Also, some kids don't have access to internet. So I think, kind of as a policy implication is to get more access to technology for people that wouldn't already have it, so that they can work from home, so that they have their computers, that they have their internet access, because that's been another level where it's been really unequitable, is that not everyone has their own computer. Some families have maybe one computer or no computer. So if you have 3 kids, how are they all going to do their work on one computer, or maybe one computer that doesn't even work good, or no internet, So I think that kind of as a policy, kind of increasing that access is really important. I think it's really important for employers to facilitate connection with coworkers and teams, and to do things like this, I think, is really important. And I think this can also be an example of maybe not everyone would be able to make it to a meeting like this in the normal life, because maybe you have kids or a husband, or you're tired, or you had to work late, or whatever. And it's so I think to some degree, some of this can actually increase access. And so I think that will be something for us to kind of consider moving forward, even after the pandemic. I think that, that needs to be balanced with kind of work overload, right? So there's been times where like I've been getting, at the 4th of July, I had a friend that I've been quarantining with who had a little bit, so I got to go do something fun on the 4th of July. But I had colleagues that, they're staying at home and maybe someone in their circle isn't doing anything. So I got so many papers. People were working on the 4th of July all day. And so I think that there's kind of this like, that we do have to kind of be careful as a society that it's not just like there's no fun, there's no leisure time, that even when you're working from home and stay at home and everything, that we're kind of like finding these demarcated endpoints, both for our media consumption as well as for our work, right? So that we can strike more of a balance. I think that there are some really exciting opportunities with both, again, Zoom, mobile apps to promote fitness, health, psychological wellness. There's a lot of telehealth now. And again, that's just a financial issue, right? Like it can be really hard to pay to go see a psychologist and go to the office, but some of these telehealth opportunities are a lot more cost effective. So in that way, I think it can help, increase access, which I think is really important. Yeah, I just think that it's really important to be kind of mindful and intentional about these choices, because I think kind of our shifting paradigm of work and connection through technology can have a lot of benefits as well as drawbacks. If we can kind of do it mindfully, that I really think that we can leverage the benefits of this technology with the goal of increasing access across socioeconomic groups so that these resources are more equitably distributed in society. Yeah, and there's a lot of data that has shown that, particularly like when kind of circling back to this issue of like kids in the schools, that access to technology mediates higher academic achievement in low socioeconomic students. So basically, even if you have low income, if you have access to technology, your academic achievement is higher, irrespective of income, right? So it is critical to get those resources to communities. Yes?
Do you want to answer a few questions?
Oh yeah, sorry. I didn't even know if I had enough notes, and then I just started rambling.
Oh no, that's fine. We can wait till the
yeah. No, I was done. I was wrapping it up. Yeah, so kind of like with my closing points, other things I think I love meditation. I teach meditation, so if people are interested in getting involved in any of my groups, we'll certainly post my email. There's also a lot you can do online on apps. There's a lot of people offering free things, which is great. Making sure to have exercise, taking time for gratitude, spirituality, and people love to feel in control and like they're making a difference. So doing anything in your community that is action oriented, I think would be great as well. So yeah, that's my 45 minutes.
Well, one of the questions is, it's in terms of the period of recovery from all this stress and trauma when people are able to move on with their lives. And do you think that millennials and younger people recover from this trauma and stress of the pandemic faster than older people? And how long after this threat is over would a recovery take? I know it would depend on the intensity of it, but
that is a great question. And I think we are going to see a lot of research about that. So I have a couple ongoing studies on COVID-19 right now, and we are consistently seeing younger people more distressed, which is not what we typically see. Usually, so it is really the younger generation. They are pretty freaked out. I think that they have so much uncertainty with their future, what's going on with their college. Can they find a job? If they have a job, can they move up in their career? So I think there's just so much uncertainty for these kids that, again, I think it's really important for us to be working with them and creating more resources for them so that they can get their lives. Yeah, their lives are put on hold. College is off. I have a student, friend of a friend who's a student, and she was taking her classes at community college to try to transfer to a UC. And she was like, I'm not paying for these community college classes because I'm taking them in my bedroom. I'm just going to go when the pandemic's over and I can actually go to school. Yeah, it's new to everybody.
And then another question is, do you think that the disparity in political views vis-a-vis Ebola and COVID could also say something about a disease that feels more threatening to the respondents? Ebola never felt like a threat on our shores, unlike COVID.
Yeah. Yeah, it's interesting because, there's a lot of difference between Ebola and COVID. Ebola was it's kind of hard to catch Ebola, actually. It's very easy to catch COVID-19. So there was that, but it's still interesting to see that there is this strong difference with political party affiliation, that it's flipped. It's completely flipped in the other direction. So I think, we don't know for sure, but I do think it has to do with kind of like maybe the leadership and whether people are identifying with the leadership, maybe how the leadership's handling things. Doctor, you argue that not enough stress exists. We need to be more stressed out.
Wow. I have a question for you, Doctor. The fiercely different perspective based on one's political views, the different actions. Does this political war, practically left and right, especially in response to this pandemic, does that add a lot of stress to people?
I think so. Yeah, the political upheaval, I think, is very distressing. I saw a poll, probably some other people saw it too. It's pretty widely reported that 85% of Americans think the country is out of control.
Yeah.
People in stress and coping literature, they like to feel like they are in control. Feelings of control are adaptive. When things are spinning out of control, that is not good for mental health in general.
Yeah.
Yeah.
Well, we thank you so much. This was really wonderful presentation. We thank you for sharing your time with us, and we just really appreciate it. So thank you so much, Dr. Garfin.
Yeah, of course. I'm happy to I don't know if you logged on, but I can hang out for another minute.